Hi there. It's okay. It's okay if you're awake. The anesthesia should make you feel sleepy, and it will completely numb everything. You won't feel a single thing, okay? If you are awake, just make sure you stay still. But this won't take very long. You won't feel anything, okay? Nurse Jameson and I have you. Alright. Alright, Hildy? Yeah, prep pads, please. That would be awesome. Yeah, tweezers. I need the other prep pads as well. Awesome. Let's say like 25 minutes. It's a really fast one. Okay, tweezers. Thank you. You just have to go in, and you'll be doing these soon too. You want to make sure that you get any debris, because when you put the new ones on, you don't want anything with contact between the skin and the new ones, obviously. So we just go in and are very precise. Yeah, probably like 6 months. You gotta assist with quite a few first. No, this patient came without any. Some people are getting replacements when they already have some, and that's a completely different operation. Yeah, you're doing great, okay? Just close your eyes. Okay. Prep site looks good. Give me the other prep pad. Thank you. Great. Yeah, the sticky ones next. Yeah, we use an extra numbing agent because the anesthesia doesn't always knock them out, which is fine. Better for them anyway. And we use the, yeah, that third kind. That should be like, oh, perfect, thank you. We also use an adhesive kind, and then obviously the cleanser. This kind requires a little bit of precision because you don't want the glue to be in a place that's not going to come in contact with the new ear. So we're very careful to place it only where we need it. It's really hard to get off. You can get it off, but it adds, you know, too much time to the surgery, and we like to keep the surgery as short as possible. There we go. Other side. You'll get good at knowing that, you know, I've certainly had several surgeries that went over because I did the glue part wrong. And you just learn where it needs to go, pretty much. Let's see. I'm gonna need to do a quick measure before we put the actual ear on, okay? So I need the tape measure next. I'll need you to take some notes. I'm going to say numbers at you and you need to write them down. And that's how we're going to choose the ear from the cabinet that we're going to use, okay? Yeah, we do a dusting of... Okay, so I'm going to measure first. And actually, sometimes we like to do the measuring before we do the glue part. Probably would have been a good idea, but it's okay if that step doesn't go. Where is it? Okay. Thank you. Alright, you ready? Okay, Hildy, 2.1. It should be a list. There should be a list. And I'm just going down the list, okay? Perfect. 1.3. 3.2. 0.6. 2.1. 2.1. 0.7. 0.8. 1. 1.3. 2 and 2 and 2.1. 1.8. 0.8. That's 6.1. Oh, 6. Yeah. This is 7. 3.2. Okay, 3.2. And 5. 3.5. Okay. Is that the last one? Okay. That one's 9. Yeah. Okay, other side. You ready, Hildy? It's 3.1. 6.5. 3. 4.7. 4.9. 6.7. 3.6. 0.9. This one's 8. 5.2. 3. Exactly. 1.2. 2.2. 7.1. And 9. This one's 9. Okay. Alright. If you could go to the cabinet and get the matching thing while I do the last prepper. You need to, what I'm going to be doing while you're grabbing this is the last prep pad. We had them in order. And we're going to essentially powder dust the glue part we just did. Okay. My guess is it's like C5-2. If you're having trouble, let me know. This one has a dusting of powder. What it's going to do is create a barrier, because there's adhesive on the ear part too. It's going to create a barrier between the part we didn't put glue on and the other part. So it's necessary to do all four of them. Yeah, that actually looks like someone. Good job. Pretty soon you're just gonna know. Like, it just comes naturally. Okay. Okay. Now I need to prep for the for sewing on. I need the plunger and the pointer. So Thank you. This is just softening up the points that are going to be have the, sorry, this part takes a little focus, where we're going to be sewing on. And then we need to make a couple incisions. Yeah, the patient is definitely on the verge of sleep at least. The anesthesia kind of puts them in a twilight state. We don't need them totally out, and it's just healthier really, safer. Yeah, do you have them all prepped? Yeah, it should already have the adhesive on the back. It just needs the powder on the other side. Okay? Yeah. Dr. Green's got a surgery in the other operation room today. It's just on the other side of the wall. Okay, I'm going to do the incisions next. Yeah. Yeah, they'll have you practice this one a lot on dummies first. Not like dumb people, like dummies. Okay, other side. Okay, excellent. That's the next step. We're going to go and slap those babies on. And sew it on. And then we put some ointment and a couple other little things. And it's a really quick surgery. Really quick. More than you would think, actually. It's pretty surprising. It's kind of trendy these days. Okay, awesome. Brush. Mm-hmm. And then go ahead and slap that baby on there. Well, don't slap it on. I was being facetious. Yeah, just like. Okay, good job. Yeah, and then we're just going to sew it on, so let me finish up with this one. We'll get to that. Sewing part's really easy. The incision part's definitely the hardest and takes the most practice. Okay. Alright. Go ahead and put one on that side for me if you would. Oh yeah, it's almost lunch. I'm very ready. Okay. Where's my... There it is. Thank you. And we're going to start over here with their left. And you just do just like you learned, okay? And it probably takes like, depends on how big the ears they wanted were. But you're going like every, like 2 millimeters. Yeah, you always want to make sure you have more than you think you need. Because you don't want to run out partway through. That's annoying. Oh yeah, my back is killing me. Well, so there was a film around the ear, right? We left that on. We're going to go around and we're going to trim that, okay? So we trim off the stitches, and then we trim that film that was on there. That was another adhesive measure. So, but it was kind of like paper light. I know you were worried about that. Okay. That's good. Going to grab our scissors here, do a little snippy snippy. Okay, and then we're going to go around the ear and trim off that film that was left behind, okay? Alright, and on to the right ear. All prepped. Got it on there. Let's get to sewing that baby on. Yeah, if you could get the ointment, there's 2 kinds, ready? Look at the antibacterial one, and the one that wants the healing. There's a third one we sometimes do, but we ran out. It's not necessary. Okay. Yeah, once you cut the film off, we get the ointment on. Then we just leave the patient, and we don't like to jar them out of the twilight state, so we usually reserve the operation room for a couple hours after the surgery so that they can come to naturally, safest for them. Yep, simple. Really good. I'm pretty sure we'll be doing them in about 6 months. Alright, and then you just do the trim here. And you got my ointment clipper, yeah. Oh, right, I gotta cut those stitches off. There we go. And it's really actually pretty genius. Okay. Right, you got that ointment ready for me? Cool. You rub this on the new ear as well as all over the incisions, and yeah. Yeah, it's supposed to moisturize the new ear, kind of get it flushing out, you know. Okay. Yeah. Simple as that. Yeah, you got the other one? Cool. Gotcha. Okay. all done. And we just let him stay here, let him sleep. And there'll be somebody right on the other side when we wake up. Okay. If you're still with me, you're all done. Burn a set of ears. Okay. Yeah, that's it. If you can get the lights, Hildy, we're just gonna leave them.